themselves from family, from friends, but to feel that there's no hope. But SJS Awareness UK is here to provide support so that those who have been affected by SJS and toxic epidermal necrolysis are feel supported. And so SJS started actually in July 2009, and we started by providing information and support to people who have had an experience with Stevens-Johnson syndrome in the UK, and this was incorporated into Companies House in November 2010, and it became a registered charity with the Charity Commission in 2014. So this event was birthed because Public Health England, in their report of COVID-19 and its impact on the BAME community, found that the highest age standardized diagnosis rates of COVID-19 were higher in people of Black ethnic groups. People of Bangladeshi ethnicity had around twice the risk of death when compared to people of Caucasian ethnicity. And also people of Chinese, Indian, Pakistani, and other Asian and Caribbean and Black ethnicity had between 10 to 50% higher risk of mortality when compared to their Caucasian counterparts. So interestingly enough, Public Health England actually found that this is atypical. And in previous years, all cause of mortality rates are lower in Asian and Black ethnicity group. So in addition to this, that's the World Health Organization highlighted that there is increasing evidence that people with existing conditions may be at higher risk of contracting and having more severe forms of COVID-19. And recently, SJS Awareness UK has received some funding from the National Lottery community to run awareness session for those in the BAME communities as they are being because they're being disproportionately affected by COVID. And this event aims to equip and empower communities on COVID-19 in the best ways on how to protect themselves. So that's what the
It's too slow.
I just wanted to introduce the
audience. I'm just going to ask everyone just to go through some house. Before we introduce our first speakers, to enable everyone to get the best out of this session, I'd ask that you please kindly keep your mic muted if you're not speaking or on stage. And also on your screens, if you could see the agenda for tonight, it should be on your screens. Please raise your hands and your virtual, just let us know. You can unmute your mic briefly to let us know that you can see it.
Yeah.
That's great. Thank you so much. So firstly, I'm going to introduce our first speaker, and we have Isaac, who is a biochemist, and he will be speaking to us now. So if I could ask Isaac to please unmute his mic and give us a brief presentation. Thank you.
Thank you so much. Can everyone hear me?
Yeah.
Okay, great. Thanks to SJS Awareness UK. I really appreciate the opportunity to share on the topic that is turning the world upside down. Okay, as you said, my name is Olaoluwa Isaac Taiwo. I'm a biomedical scientist, and I've been in the health industry for a decade now. I've worked in Royal Free, I've worked in Public Health England, Colindale. I'm presently working University of Southampton Hospital. I basically do more of hematology, coagulations, and blood transfusion as well. So when I was given this topic, I just felt that we all know so much about it because it's all in the media, it's everywhere, and it's literally everyone is turned to be a scientist. But having said that, there's an ongoing problem that we have that people are not trusting if they need to have the vaccine or not. And I really appreciate SGS for coming up with this initiative to resolve this problem. So to carry on with my slide, the next page just talks about, so I'm talking about COVID-19. So the next page is talking about the crisis we are. If we have a major health crisis, the Public Health England intervenes. So they look for surveillance programs and look for ways to protect the whole nation so that we can have a problem resolved. So one of the problems that we have is COVID-19. COVID-19 became a public health issue after it originated from China, and all the way because of flights, people commuting, we had a case of here in the UK. And when we had that case, it becomes a major crisis when the transmission was going beyond something that we can manage. So the role of Public Health England is to protect the whole nation and to also do further diagnostic tests in identifying any disease condition. My next slide will lead you to the details of how the virus became a pandemic. So in my slide, I said the origin of the COVID-19 infection is from Wuhan, and it was discovered, or it was made to understand that COVID-19 was made to understand that they had a case in 2019. There's still further investigation that is being carried on in terms of the origin of the virus itself. Having said that, the virus SARS itself is a known disease condition because we have SARS before in 2002, and we also have the Middle East Respiratory Syndrome in 2012. So to have the COVID-19 virus, which is one of the family of the coronavirus, in this 2019 was not, it's kind of predictable because we have a series of problems like that. The only challenge that we had was the rate of the spread of the virus and the fact that there's no therapy of how we can manage the disease condition and the transmission within the population. That was a major problem. Anyway, we all are aware of the measures that the government intervened in terms of asking everyone to isolate, to quarantine, travel ban, and these were all the preventions that were implemented by the government. And if everyone can relate with me, we are all affected by this virus. But having the virus, there was a lot of wave that came across. And my last slide will tell us about how there were cases where it affected majorly people in the care home, the elderly people in the 80s. And these people were prey of the virus because of their underlying conditions. So we have cases of our elderly people that they have a problem of maybe heart problem, cardiovascular problem. They could have some pulmonary problem. They could have diabetes. They could have other underlying problem that makes their immune system not suitable to manage or protect them from the virus. So in the graph I showed, shows the peak we have in some care homes that was studied during this period. And the peak was so much that it's literally the first wave, literally we're thinking it came only for the elderly population. And before we know it, further research were done, and there's still an ongoing research that is being carried on, where we find a situation where they said we, the ethnic minority, the Black Asian minority, are a victim of COVID-19. More research is being done in this area of developing why are we more susceptible to the virus than the other group of the population. And my next slide will talk more about the second wave. So when everyone was so aware that, the virus it only came for people in the 80s, people above the age of 80s. People were so passionate that, the virus is not for them. So the younger population, people in the 30s to 40s, and people under 30s, had a situation where they feel they are immune against the virus. And we find a second wave in the UK, where a lot of people were infected, especially students in the universities. And the mortality rates continue to increase. And when this increased, we're so worried that, are we really going to come out of this virus? Until today, the statistics still shows that we are not anywhere near. We're still working on more research and more findings on discovering the virus. In the course of the first wave, the second wave, and the present situation where we are in now, the scientists and other researchers, which everyone is also involved in doing their own part, as washing their hands, isolating, locking down, quarantines, restricting their travel to areas that are highly risk to travel into in Tier 4. In my next slide, there was a solution that came up. So there are a group of scientists that came together, and they felt some people are asymptomatic and they develop antibodies against this virus. I was one of them, because when I tested positive for the antibodies. I haven't said that I didn't fall ill, I didn't have any problem. But the good thing is, they now came up with this research that let's take the plasma, the blood of these people that are positive with the antibodies, get them to donate their plasma, and that plasma will be transfused to the right patient that have similar blood group as people that were positive. So I was involved in this research that we're giving out. I didn't donate my blood, but I was opportune to be part of people that issue out the donor blood to patients that are positive for COVID-19. I would say this research was very successful in the sense that you select some patients who will need to be on the study. It's not yet a treatment, it still was a study. You select a patient who needs to take at least 1 unit of the convalescent plasma. And when it's transfused, obviously the nurses and the doctor will monitor if the person that was positive with COVID-19 is having any transfusion reaction. And if they are not having any transfusion reaction, the doctor will probably prescribe a second dose. So what the plasma does, the plasma, for somebody that is healed, the antibody in the plasma will bind to the virus and neutralize the effects of the virus in the body of the positive patient with COVID-19. Unfortunately, the government have stopped this study, and because the study was really borrowed from a similar study that was done in China. So the government have stopped this study at the moment. So we're focusing on other preventative methods. In my next slide, one of the methods, or I would say one of the measures the government now put in place, was to introduce the vaccine. And I think the vaccine was a big bonus for the whole world, because this virus has caught us unawares to know how to treat it in terms of therapy, and it's caught us unaware on how to know what to do in limiting the spread of the virus. So I had the vaccine, and I was happy I did. But what I will be emphasizing more on, I will be telling you the story of how I went about having the virus vaccine, COVID-19 vaccine, and my journey throughout the reaction that I had as well. Another thing to emphasize, the vaccines, there are many vaccines all over the world because this is a pandemic, it's a global crisis. But in the UK, at the moment, we have the Pfizer vaccine and the Oxford vaccine. But because of time constraint, I will only be telling you more about the Pfizer vaccine, which I had. So in my next slide, it tells you about the journey of my vaccine. So I booked for the appointment, and I was given the opportunity to read the information about the vaccine. Then afterwards, I proceed to the doctor or the person that prescribed me to proceed with the vaccine. She asked me a series of questions, which I answered. And after answering the question, I was asked to queue up to go into the clinical room where I had the vaccination. And I waited for 15 minutes to see if I had any reaction. And to be honest, just like every other vaccine, I didn't have any reaction, but the pain at the site of injection was obviously normal. I had that pain for about 24 hours. And after 24 hours, the pain was all eased off. But the government is still asking people that if you have any reaction that is not listed in the information you read at the vaccination hub, you should kindly let your doctor know, or your pharmacist know, or your nurses know. Why is this vaccine important? If we all work together, we'll be able to fight this virus. If we all do our parts, we're able to make sure that we can come back to normality. So when I had the vaccine, as I said, there was not so much reaction. It was just normal. And what I said earlier, what the vaccine does, or just like the antibodies, the role the antibodies play, it just helps you, it binds to the antigen of the COVID-19. And when it binds to it, it neutralizes the effect of it. So it makes your immune system ready for the actual infection. So if you have the actual infection, your blood system will have had a memory of having such a antigen in the bloodstream. So in that way, you are more protected. And my next slide will tell you about the vaccine more. So the mRNA vaccine is a BNT162b2, which is used for active immunization to prevent from COVID-19 disease caused by SARS-CoV-2 virus. It is only given to adults, not to any adolescents, people under the age of 16. So as I said, to reiterate, the vaccine triggers the body natural production of antibodies, which helps to stimulate the immune cells and protects you for the actual COVID-19 disease. So another thing in my next slide, it warns us that if you're on any allergy medication, the Pfizer vaccine may not be suitable for you. But having said that, you're warned, if you have any allergy reaction, you need to speak to your doctor. You need to speak to the nurses so that you can get proper advice on what best to do. And also, to be honest, if you go for the appointment for this vaccine, the doctors are there, the nurses are there. They'll be able to answer all your questions, and you can also tell them your health history, which will be very helpful. So I'll tell you the contents of what is in the vaccine. So obviously, if you're on any medication, you can always look out for, in my next slide, it says you the content of what is in the vaccine, the mRNA vaccine. It tells you there's an active substance of BNT162b2 RNA, And this is dilutes about 5 doses, and it contains about 0.3 ml with 30 micrograms of mRNA each. It contains a polyethylene glycol microbe as part of the ALC 0159. I won't bore you with all the chemical compounds, but the emphasis here is if you're allergic to any of the content of this vaccine, then you can raise that with your doctors, and there are other options that you can go for. There are Oxford vaccine and there's Moderna vaccine that is available as well in the country. Okay, my next slide will tell you about the common side effects that you can have. So most common side effects, according to the research and with people's feedback that have had the vaccination, which has protected them from the COVID-19 disease, is there will be injection sites that could be swollen, and there could be redness at the injection site likewise. You can have nausea. These are common ones, but I told you of the experience I had. I only had pain at the injection site, and that was it. But the common ones that majority of people complain or mention is the pain at the injection site, the tiredness, the headache, the muscle pain, the chills, the joint pains, and the fear. So in a way, to conclude my conversation on this COVID-19 vaccination is to tell us the benefits. I emphasize that if we all work together, we'll be able to defeat the COVID-19 virus that has brought the whole nation to what we are now. And the benefits are, we'll be able to go back to normality. It will reduce rates of mortality among all age groups. It will protect us from severe illness and people with underlying health condition, which their immune system is suppressed, will be protected just for us playing our own part. It will protect our economy, it will protect the future of unborn children. It will protect family, friends, colleagues. It protects the United Kingdom, it protects the whole world from this deadly virus, and it brings back trust on the health professionals that are on the front line doing all their best to make sure that the vaccine is rolled out and we are able to do something to curtail the effects of this COVID-19. So from my left side just tells you that if you have any question, I want to acknowledge Auntie Nadia, Lawson and Gifty, and Emanuela and other speakers on the platform. I want to appreciate people from the University Hospital Southampton as well for their hard work, and other healthcare workers on the front line. And I also want to appreciate everyone playing their part, isolating, sticking to the government guidelines on COVID-19. If there's any question, I think there's a question and answer later, but I'm not sure if I'll be around at that time. But over to you, our presenter.